Welcome to your essential PTCB prep guide. Today we're diving deep into the terminology every pharmacy technician must master: generic names, brand names, and medication classifications. Understanding medication terminology is the foundation of pharmacy practice. It ensures safety, accuracy, and clear communication in patient care. We'll cover the three main pillars: generic names, which are the non-proprietary names; brand names, the catchy trade names; and medication classifications, which group drugs by their action. Mastering this information is crucial for passing the PTCB exam. You need to confidently identify and associate these terms to ensure proper dispensing. Let's start with generic names. These are the chemical or established names of a drug, standardized and often derived from the drug's chemical structure. Generic names often share common suffixes to indicate their class. For example, drugs ending in pril are usually ACE inhibitors, like Lisinopril, and those ending in LOL are beta blockers, such as metoprolol. A common example is Amoxicillin, an antibiotic. Another is Lisinopril, used for hypertension. Recognizing these suffixes can quickly tell you the drug's class and function. Next, brand names, or trade names. These are proprietary names given by the manufacturing company for marketing purposes. They are often easier to pronounce and remember. Pharmaceutical companies hold the exclusive rights to market a drug under its brand name, typically for a set number of years before generic versions become available. Taking our previous examples, Amoxicillin's brand name might be Augmentin, and Lisinopril is often marketed as Zestril. You must know both names for safe dispensing. Medication classifications are groups of drugs that share similar mechanisms of action or treat the same condition. This system organizes drugs by what they do in the body. The classification is based on the drug's mechanism of action, that is, how the drug affects the body at a cellular or molecular level to produce its therapeutic effect. For instance, antibiotics can be further classified as beta-lactams, like penicillin, based on their chemical structure. Lisinopril belongs to the class of ACE inhibitors, which relax blood vessels. Now let's look at a few high-yield examples that frequently appear on the PTCB exam to solidify your understanding. First, atorvastatin, brand name Lipitor, is classified as a statin. Statins are primarily used to lower cholesterol levels by inhibiting a key enzyme in the liver. Next, metformin, commonly known as glucophage. This drug is classified as a biguanide, a first-line treatment for type 2 diabetes that helps lower blood sugar by reducing glucose production in the liver. Finally, gabapentin, often sold as Neurontin. This is classified as an anticonvulsant and is widely used to treat seizures and neuropathic pain. To wrap up, remember to focus on the suffixes for generic drugs, associate brand names with their generic counterparts, and understand the mechanism of action for classifications. Good luck with your PTCB exam.